Well, I'm Adrian. I'm going to talk about designing for survival, how to make mobile apps or any kind of app for cancer survival, which means people who had or are having cancer or are involved in somehow in the cancer cure process. So, why? But first of all, did you all had coffee this morning? Yeah? No? Yeah, okay. It's a good start. Is there anyone who is not involved in UX around here? Raise your hand. So everybody's in UX. Awesome. So I know how to fit my presentation. And one more question. Did anyone design for healthcare? Any kind of healthcare app or any way working with patients or doctors? Please raise your hand so I would know. Okay, so I would seem to actually say things interesting. We'll see. So why? Well, I'll start with a short story. So meet ELISE. It's not a persona, it's not a scenario, it's a real story. It's a friend of mine. She's 23 years old, she's red hair, quite tall, I would say. She's a Lindy Hop dancer. If you don't know what that is, it's like swing dancing, cool stuff. She's passionate about drawings, surfing, pasta, jazz, and love cats, as you could see. Actually, I managed to find a good drawing that resembles her, so not to use the real photo. So, I'll tell you her real story. It goes like this. She went surfing because she was an Erasmus student in Portugal. Cool place to go, actually, cool place to surf. She had an amazing time there. She was with her friends. A really nice place. And, you know, she had fun. Have you been Erasmus, any of you? No? Nobody? Yeah, there's been some. So, you know, parties, enjoying life, good. Yeah, you know, booze, you know the stuff. So she went there dancing also, again, nice, and then come back to her country, and she just couldn't wait to get, this is very sensitive by the way, to get back to Portugal because there she met somebody and it was falling in love, life was quite nice, but, you know, exams, you have to study hard, things are quite hard, but one point she realized her back was hurting very badly, like, you know, just regular back pain. So she went to yoga, she did some stretching, but still the pain didn't go. So she said, okay, let's go to the doctor and see what's happening. So she started, by the way, it's not very funny story, so you won't be laughing, sorry. It's going to the hospital, yes. So she went to the hospital, make some analysis, saw that she has a problem on her back, and by the way, can we make a small exercise? It's very simple. Do you know what device is that one? Have you been in one? Yeah, so you know what that is. You know, it's the nice thing when you stay and you hear like hard for 2 hours. You hear this in your head. Get used to it because, you know, she was there 2 hours and a half. And this was harder than that. Not breathing too much because she has for the back, you have to breathe a little bit, not because if you do that, there's somebody screaming, stop! Seriously, that's what you hear, like, doctor, don't stop because you're going to analyze, you have to do it again. So she took this, and, well, it shows a small tumor. Didn't seem to be that bad, seemed to be operable, so I said, okay, we go. She knew what the procedure was, went, took off the tumor. 2 weeks later, she got the results from the tumor analyzed, and it was not so nice because she realized she has cancer. That was the moment when she said she cried for the whole day. She didn't want to see anyone, and she said, okay, I have to do this, so she went to the chemotherapy. I hope nobody knows anything about chemotherapy here, because if you know, well, you've been somehow involved in the process, and I hope you did not. So she went for 8 months to chemotherapy, which seems not so bad at the beginning. Like she was, okay, I have this needle in my hand, it hurts a little bit, it's fine. And after the second time she went, a friend came to take her from the hospital and said, hey, hi. She stepped up and then fall on the ground, just flat, because she couldn't stand on her feet. She had friends coming, she had a chemotherapy, and in the end, things went well. Chemotherapy was successful. 2 years passed. She doesn't have any more problems. For now, she went to analysis every 6 months. She goes for a checkup. Everything is fine. But let's dig deeper into this process. What happened during that time? So when she went to chemotherapy, there were 5 girls, her and 4 others. And that process took 8 months. During those 8 months, 1, 2, 3, 4 of them didn't make it. Just one survivor, that was her. They had the same cancer form, same stage, same treatment, same doctor. Of course, you'll say that, bodies react differently and all these things, but still very, very similar. So what made the difference? She had no prior oncology knowledge. She had no special treatment, no special access. There was no difference between them, apparently. But she was a medical student. Her father was a doctor. So what made the difference? The difference is that when the doctor told her, well, you have to take 10 analyses, she researched and said, no, actually just 5 are relevant, and I should do these 2 others which are not relevant. And when she was going to the hospital, she knew, well, the needle doesn't go on left hand because it's not so good, do it on the right hand. And so it's like small stuff that she kind of helped her in a way. We don't know. We'll see later about that. We look at the numbers also. Cancer, it's a big thing. Just in 2012, there were 14 million new cases and 8.2 million deaths, just in 2012. 1 of 3 people have a chance to develop cancer. I'll skip some of the things. And there are 100 forms of cancer. Anybody can be affected. So, there's a bird, there's a plane, there's no Superman. There's no silver bullet. I don't know how to cure cancer. If anyone knows, please, go make some money and do it. So we have the UX process. We have an analysis. We have to see what is the problem. Where can we fill in the gaps? Which are the problems that we can solve as user experience specialists? What are the things that are not done so well now? And some of them you actually saw them previously because there was a lack of information and communication between the doctor. So I'm not going to get to the UX process because everybody is familiar. You talk with stakeholders, you make user interview, do peer personas, you create a prototype, you test it, and then you iterate, you make a better product, and then you add in the market. But it's not that simple. It's not just designing a product. It's not just designing something. I mean, I've been working for 14 years doing various kind of projects, including healthcare, but when I got to work with cancer survivors, I realized everything was different. When people were saying, I feel pain, it didn't mean I feel a little bit of pain so I cannot focus. It means he cannot focus at all. When he said, I will be careful about your application, he didn't say, I might use it, but he will use it 100% because he will know he might die, so he has to use it. So everything is a little bit changed. So you really have to understand it. By example, do you know what this is? I hope you don't, seriously. Because this is a chemotherapy device. You have this needle and stuff, so that's the first thing. You have to read a lot. You have to work with doctors. It's a complicated process just to understand what cancer is. For us, it took us just 6 months to get a small grasp, and we didn't spend 15 years or 10 years as doctors do. So it's about the teamwork. How can we divide work? If you have a bigger team, it's better. We can connect with the doctor, we can have more user interviews. So it's always about working in a team and putting all the data together. So we usually start with a stakeholder meeting. Because stakeholders is not just doctors and patients, it's family members, it's medical centers. Some medical centers will take some cases, some not. Some would work with you, some would not. There's also other cancer survivors which are willing to help. NGOs, it's big word. It's not just doctors and patients. It's not like I design an app for a cab that I'm going to call. No, it's much more complicated than that. And the main thing we got out of it is that there's a lack of information and communication. People don't communicate properly. They lose information in the process. Things don't get where they should be getting. So we dig deeper and we find some main issues. There's no direct access to patients. As UX, you cannot go in a hospital and say, can I talk with your patients? No, you have to complete its forms and it takes 6 months. Oh, maybe 2 years, but it's okay. So you cannot get there. You cannot just go in a store and say, hey, we'll ask the third guy who comes in the room about using the app and we'll give him a voucher. It doesn't work that way. And doctors are hard to get. They're very busy. All the doctors we work with we had first interviews in their lunch break while the phone was calling and the nurse was saying, hey, Dr. John, could you come back because there's this emergency? No user-centered approach to design. People don't think about user, think about just programming the old way. We make a program, we launch it, and people will use it. Not very useful. I mean, not very usable because people don't focus so much. And the patient is not an active part. He's just the guy or girl who has to do stuff, have to be in places. Nobody asks her, except, do you feel bad? Okay, check. Do you feel that? Check. But don't ask her, would you like to make it better? Would you like to be a part of this? Do you think it would be better if we would do things different? No, they don't care about that. And there's not enough communication from doctor, nurse to patient. Again, I click too much. Damn it. High stress for doctor and patient. And when I mean high stress, I mean doctors and patients. Patients are like you go to chemotherapy, and from chemotherapy you go home, and before that you went to work, and you should be feeling fine, focusing on your studies as she was trying to do, and in the same time working. So it doesn't work that way. I'm bad at this. I had too much coffee. I'm just clicking. So we start with contextual interviews. You have to go there. You have to be in the chemotherapy room and talk with the doctor, with the patient. You have to watch the doctors doing things because they will give you some information. The doctor will tell you, I cannot contact the patient. Actually, he will tell you he has a bad system on his iPhone and he cannot find the name, not he cannot contact the patient. So you really have to understand what is the problem behind it. And you have to be very discreet, just in the corner, taking notes. And then after you understand their life. Also, patients, it's very hard because they will want to talk about their story. At the same time, they'll be quite shy, so you have to be quite careful how you open the subject. Well, you'll build personas, but again, think about it, not just, I clicked once. Well, you have cancer survivors, you have people under treatment, you have family members, you have to put them in the loop. Most people don't. You think just patients are themselves, but I don't have much time. But, doctor, a family member spends 27 hours per week caring for a patient. 27 hours. Think about that, what means in time. Money coming and just nerves and stress. They have to be there. And of course, the doctors, you need them. After you build the personas and you have the first user interviews and stakeholder, you will build a user journey to find where are the places where we can improve, where things get lost. Things get lost because there are different systems. And when you just have the graphic, you would see that something, like, in Denmark, by example, a patient is treated for cancer, right? And he has every 2 weeks a meeting. But the chances that he would go to the same doctors 2 times in a row, it's 0. He goes during a year to 12 doctors because the doctors are busy, so he just goes to the next one. And he has 15 minutes in which 10 minutes he spends talking about how he feels to a new doctor. So there you see an opportunity to improvement. Or any kind of healthcare system. I'm not talking about just cancer care, just make the user journey. People here are from UX, so I'm not going to talk too much about user journey. You know what that is, right? Right? No? Okay. So you do mock-ups. And, we used to this process, we make some paper mock-ups, and then we go with the doctor and say, no, I don't care about that. And say, well, maybe you could talk about the initial idea we have, and say, no, this is just paper, I don't care, I don't have time, bye. So we realize we cannot use a normal process. We have to use them internally. We have to use it while we work with the team, but not with the users at all. Then we develop lo-fi prototypes, which work, are interactive, which try to talk with the doctor again. No. If it's not a real app, I don't have time, I don't care, go somewhere else. So again, we test ourselves. We think about more platform because we want to reach everybody. Not everybody has an iPhone, so we don't design for iPhone 6 only. So we make advanced prototypes, which is a mess because we have to really dig deeper. We have to use a jQuery platform and test it, which is scalable, so it can work on smartphone and tablets and desktop application because we want to reach more clients and more people. And to sum it up, I think I still have a little bit of time. We're talking just fast about the design challenges we faced while working with healthcare. Time is of the essence. Iterate fast many times. Doctors get 10 calls a week for people who want to sell them stuff, solutions, want to get in contact with them. So you have to be fast. Every week you come with an iteration, with an improvement, and they really help you with that. They really like it because they can go further. Doctor position to change. Again, they have their own systems. They don't want to just learn something new, so you have to come with something that can build on top of it. Doctor and patient want to test a real product. As I just said, you have to use something that works as a real application, not just a prototype that you click something yourself. He has to use it. Really? Too much coffee, as I said. You need domain knowledge, and there's a high level of stress in system. I overemphasize on this, but it's really important. Patience and empathy. Also, access to patients, and the solution is talk with a medical center, offer the app you're going to develop or the system you're going to develop for free. Make them part of the process, and they will be interested to join you and help you. And that was pretty much, and now it doesn't work. Come on. Yes, if you have any questions. That was